Hello, hello. It's Friday and it's the end of a second legislative week at the Oklahoma State Capitol. So I wanted to give you an update. Clearly, I'm working from home. You might see children or dogs come running through at any point. This is my life, as it's probably the life of many of you trying to work from home more and more. This week was tough with the cold weather and school being out again for us. So I hope for you that you were able to have a good week. And I certainly am grateful for my warm, dry home this week. And I'm appreciative of all the work, especially locally, the city of Oklahoma City opening their emergency shelter for those who don't have homes. I hope that we're able to serve that population well. But I just want to give you an update. I'll try to be quick, but certainly welcome your questions, concerns, ideas. This was the second week of the legislative session. We spend a lot of time in committee at this time of session, so we're really vetting all the bills. It's the first time they're heard in public. So we have committee meetings that might have 10 to 20 bills on each agenda, really trying to make sure we're thoroughly vetting those bills and asking the hard questions that need to be asked. Sometimes we get a chance to talk to the author ahead of time and get information needed, and other times we have to ask those questions in the public meetings because we want to make sure we're getting all the info we can and that the public can hear more about these bills to understand what changes might happen with that legislation. So this week I saw especially a lot of bills in the Finance Committee that look at our tax system, look at the processes, some concerns around things like debt collection and how we handle that as a state. We also had a Rules Committee meeting, which that committee specifically focuses on elections, administrative rules for our government, as well as ethics. And I had a bill in that committee this week that would have required legislators to do 1 hour of ethics training per year. And this idea was not popular with many of my colleagues. Right now, our legislature doesn't have a requirement for ethics. That's something you can seek on your own in terms of getting training from the Ethics Commission or from other entities that might provide professional ethics training. I felt like it was a real challenge going from being a candidate to being an elected official with the kind of responsibility and authority we have, really affecting lives and certainly affecting state employees and others that we make policy for. So that's something I really want to see is us seeking out training and doing it as a body. So it's not just each of us individually getting an understanding of what potential conflicts of interest might be or where our power imbalance might affect how we work with folks. So anyway, that bill did fail. It's the first time I've had that happen. And I wish I'd had more time ahead of time to talk to my colleagues. And I certainly learned from that in terms of, bills like that, we need time to talk it through and make sure they understand where I'm coming from and what the point is of those bills. But if that's something important to you, certainly I heard from my constituents when I knocked on doors how important it was to you that we have systems in place to hold our government accountable and our elected officials doing things on the up and up. So we'll have about 2 more weeks of committee. So lots and lots of bills. If you have specific issues you're watching, please reach out. I'm glad to tell you where things stand or what we've seen. And then we'll shift more to floor work when things go to the Senate floor. Next week, there is one big news item from last week that's continued is the Legislative Office of Fiscal Transparency. You may have seen the report they released about the coronavirus funds and how our state spent those. Really, the governor's office was in charge of those funds, and a lot of questions from the Loft report about how those funds were handled. I've read the report. I've read the responses to the report, and I look forward to the hearing to gather more information. I think, fundamentally, my biggest challenge is whether those funds were spent in the best way possible to benefit the people of Oklahoma, our health, the challenges that I'm seeing in the economy of unemployed people or people who are having hours cut back. My first concern is us getting through the pandemic in terms of our health and then making sure we're rebuilding the economy in a way that everyone can participate. So I think those are the big questions I'll be asking about how those monies were spent. About how they were prioritized and whether they're going to benefit many members of our state throughout. I do want to mention, you may have seen yesterday that the vaccination announcement that we are at a phase where they're going to let the next phase of the vaccination distribution get vaccinated, get appointments starting on the 22nd is what they're saying. So it has been 65 and up Oklahomans plus healthcare workers. Now, those of you living with comorbidities, things that make the virus especially challenging for you, will be able to get vaccinated. And I'm very pleased to see vaccinations will be offered to teachers and to our school personnel, because certainly we need them safe and trying to minimize the spread in our public schools. So I'm glad that that's moving forward. There are a couple different places to learn about vaccines now, and I've heard some confusion about that, but I mean, it's great that we have more opportunities. So you can sign up through the state portal. I think that's always a good idea because the portal will tell you a lot of the opportunities to get vaccinated. The other option for Oklahoma City area, Oklahoma County, City County Health Department has a very easy to use page called VaxOKC, VAXOKC.com, where they're listing all the sites they have available. And it's a quick sign up. I think a lot of people found that easy to use. And then private pharmacies are going to be able to offer it soon. So I think you'll be seeing more and more opportunities, and that'll be needed because I read that there's 90,000 teachers and public school employees that will be eligible, and then 1 million Oklahomans living with comorbidities that'll be eligible. So we're going to go through another cycle of low supply, high demand, and hopefully the amount of vaccines we get in the state will keep going up so that we can accommodate that. But please continue to stay safe. It's been amazing to see our COVID rates go down. Still too many deaths, and we need to slow that virus down. It's going to help us get through this vaccination cycle if everyone can continue to mask and socially distance. And I don't know if you're like me, but I've reached my end of my patience with these challenges in our schedule and in our lives. But if we can keep it up for a few more months, we'll get a lot more people vaccinated and be a lot safer. So thank you for keeping up. Please be in touch with my office if you have questions, concerns, ideas. Julia.Kirt@oksenate.gov. You can call our office, 405-521-5636. I'm glad that my assistant Elizabeth's taking the afternoon off, so we won't answer the phone this afternoon, but I'm on email and certainly back out at first thing Monday. So I hope you have a good weekend. I hope you stay warm and dry, and see you soon.